I'd like to next present our next panel speaker, our next presentation speaker, Bonnie Westra. And Bonnie is, Dr. Westra is an associate professor at the School of Nursing, University of Minnesota, and she's responsible for coordinating the nursing informatics specialty in the graduate programs. She has 12 years as a lead informatician with a successful startup company. She's served on the board of directors for AMIA, as well as a co-chair for the Alliance of Nursing Informatics. She also serves on the Minnesota e-Health Advisory Committee and has co-chaired the Minnesota Effective Use of Electronic Health Records Work Group. And she has extensive research and development in terminologies, secondary use of data from electronic health records, and using standardized data. Dr. Westra also co-leads the National Conference on Nursing Knowledge for Big Data Science to Transform Healthcare. Dr. Westra. Thank you.
Good afternoon. What I'd like to cover in the next 12 to 15 minutes is, first of all, to share with you information from our National Action Plan that we created last year at our nursing conference, and we're holding again this year, and then encourage the use of standardized data for documentation, and specifically SNOMED, CT, and LOINC as national standards for clinical data to be able to do exchange of nursing terminologies and have bridges for the nursing terminologies, and then to advocate for participation in standards organization and policy initiatives to ensure a nursing voice. At our conference last year, the University of Minnesota School of Nursing was a sponsor with the people listed here as steering committee members, so we really tried to get together a national group who's been longtime pioneers in the area of terminology and data standards. And this is the group of folks that we invited to the conference. We tried to have representatives from education, practice, finance, policy, every area we possibly could, to try to think about a national action plan for how to implement standardized nursing terminology for big data science. So there was a call to action, and that is nursing information really is not captured in ways that makes it shareable and comparable, which is essential for big data for quality improvement and also research for purposes of patient safety and outcomes. So nursing has a long history of informatics development, but the implementation of that actually really lags. So our primary goal is to guide consistent documentation and data collection to support big data research in transforming healthcare. At our conference last year, we created a national action plan to help prepare nurses for meeting informatics competencies, to integrate nursing information into health and healthcare knowledge systems, to optimize nursing language and healthcare information, and then create clinical data warehouses to use EHR data in order to influence health policy. So as we looked at that, advancing the vision of a transformed healthcare system, informatics and health IT actually have the potential to reshape the healthcare, as we've heard in our presentations early on this morning. And we need to transition to a more coordinated structure, make information more easily and safely shared among patients, consumers, and providers, which also was emphasized in our morning keynote speakers, by our morning keynote speakers. And we want to be able to improve outcomes, quality care, and lower costs. So that means that all providers, health systems, hospitals, patients, and consumers must have access to real-time, accurate, and actionable health information. And that if we want to be able to do big data science, it means that we need to be able to have structured, standardized data that can be pulled into our clinical data warehouses. This is a picture that we've worked with for years, which is when we think about clinical data, meaning other data is on the lower left side of the screen, we're talking about our typical data sets of demographics, ICD-9, medication data, vital signs, CPT codes, etc. What oftentimes is missing is the clinical data represented by the nursing minimum data set shown in the upper portion of the screen. Harriet Worley and Norma Lang back in the 1980s looked at what is the essential data to represent nursing clinical data. And basically, it's the Uniform Hospital Discharge Data Set with the addition of nursing data elements of nursing diagnosis, interventions, outcomes, patient acuity, and a national provider ID for nurses. In the bottom right-hand side, what you can see is we also need to include the contextual data of the nursing management minimum data set. And that is, how do we look at our staffing models, how do we look at our facilities and units where the care is provided, look at educational preparation, experience, satisfaction, turnover rates of our staff, because we know from research that they all affect patient outcomes. So we need a combination of all this data and over time and over setting to be able to really understand the impact of what we're doing to improve patient outcomes. So for our National Action Plan, we wanted to develop a strategy and a campaign, first of all, for educating nurses, students, and faculty on informatics competencies and the value of standardized data. We have many competencies that have been identified. As a matter of fact, Tom Clancy just finished looking at the competencies identified for undergraduate, graduate nurses, and specialty nurses, and found there's a lot of inconsistencies. So we don't lack for standards, we lack for consistency of our standards. In addition, AMIA has just approved by the Board of Nursing that we will have advanced practice certification for specialties in addition to medicine, which just went into effect this last year, that there's board certified physicians in informatics, and now there will be advanced certification for other professionals as well. So we really need to take a look at what those competencies are, and in addition, we need to educate faculty to help prepare people. So most of us grew up in a time when informatics was not part of the curriculum. So there are a number of efforts going on about how do we actually educate faculty to educate the generalist, much less the specialist, in terms of informatics. So another action plan that we looked at is how do we advocate for the adoption of SNOMED CT and LOINC as national standards for clinical data to link the terminologies through mappings. One point of clarification, we are advocating for the use of ANA recognized terminologies, and that SNOMED CT and LOINC are the bridges for health information exchange. So if you use NCNOC and NANDA, for instance, and you want to pass on care planning and results into a setting that uses the Omaha system, they are not exactly the same terminology, so we need a bridge or we need a link. So LOINC and SNOMED CT are the two terminologies that are recommended by the Office of the National Coordinator for E-Measures and for the CCDA. So therefore it's appropriate that nursing would use those also for being able to be a bridge. Now the challenge is that how do we really take a look at what's going on? So the implementation of standardized languages is really one of our challenges. And also the fact that if each one of us has to figure it out independently and redo that process, it doesn't work. And so we need a way of being able to share the work that we're doing so we can all work together collaboratively and have a commitment to a standard for exchange. Now, the standardized nursing languages actually started developing in 1973 with NANDA, nursing diagnosis, and then the Omaha system. And after the Nursing Minimum Data Set Conference, we had a proliferation of terminologies. ANA, after this conference, said, we will not recognize any new standardized nursing terminologies. We will continue to support the evolution of the ones that already exist, unless we come up with some really weird thing in health that has never been thought of before that could be represented by these terminologies. So what our effort now is instead of developing new terminologies, is how do we begin to think about the linkage of the terminologies for information exchange. So for nursing diagnosis, you can see that SNOMED CT is the recognized one for exchange, but there are other terminologies that also include nursing diagnosis. For intervention, SNOMED CT is recommended and as the bridge, but the other terminologies we also support the use of. And that for SNOMED, or for outcomes, it's the same. Nursing assessments, however, really the recommendation is to use LOINC for assessments and then to use SNOMED CT as the answer if it's not included as part of a structured panel already within LOINC. So another action plan is to demonstrate the value of a nursing knowledge model to advance big data science and improve outcomes. I've traveled internationally. It doesn't matter if it was Taiwan or Ireland. The nursing process is the de facto model that we have in nursing. And so it's really how do we link assessments to identification of problems, care planning for interventions, expected outcomes and actual outcomes, so that we can have not only our standards, but that we have our data that's linked for purposes of being able to reuse that. And then another action that we recommended was to get involved in terms of the data standards. So nursing really needs to be involved in being at the table, not just saying that we're a victim of standards, but rather that we're a co-creator of these standards. And that we need to make sure that the standards that get developed really help us to support the patient's story over time, to be able to gather information from the electronic health record and to be able to reuse that. And we need to make sure that we're really fostering collaboration as we move forward on knowledge translation, and that we're involved with analytics as well. So there are many organizations in which you all and us can be involved in terms of the standards. So it doesn't matter if it's HIMSS or EMEA or HL7 or TIGER, IHE, the National Quality Forum, or the S&I framework. But the bottom line is you need to be at the table. So I think the perfect example is Karen Munson and myself from the University of Minnesota have been involved in the Standards Committee for the Minnesota eHealth Initiative. As a result of that work, they focused this year on what are the standards for the CCDA so that we can help all Minnesota healthcare providers be able to exchange data, and that nursing terminology specifically was called out and how that fits into the CCDA. As a result of our involvement in standards work, I think it was last week, the eHealth Advisory Committee approved a recommendation that all healthcare settings will select and implement a standardized nursing terminology as part of their EHR. It's the first state that has ever made a recommendation specific to nursing terminology. The next process then is, so what are you going to do about it? And so we now need to move into the planning phase now that this has been put forward. And the eHealth Advisory Committee, by the way, is actually appointed by the Commissioner on Health and is a legislative committee to really move the state of Minnesota forward. Matter of fact, it is so powerful that we've had one of every O&C grant, and we're only one of 2 states that have actually done that. So Minnesota is a leader, and this is an opportunity for us to begin to think about how do we be a leader in the inclusion of standardized nursing terminology in EHRs for big data science as well as for continuity of care. So if you look at this particular website, you'll see that we're continuing with the evolution of our National Action Plan at our conference coming up in June. If you're interested in more information about it, the first 2 days will focus on what have we accomplished. Anne is one of those speakers of what's been accomplished. And where are we going next? How do you help co-create the National Action Plan? On the 7th of June, we have an optional event where it's really hands-on tutorial. So how do you actually make this happen? What do you actually have to do to have this happen? So we're really focusing on how do we really empower people to be able to create this. So if you're interested, you can look further. But one little resource that you don't see on here necessarily, there's a link to last year's conference, and there's a gazillion materials that we put together as pre-conference material that are fabulous resources if you want just a good resource to go to. So the linkage to the 2013 conference and the pre-conference materials is a great resource, as well as the presentations are linked to the agenda from last year, so we left that link up. So I'll wait until we finish with our last speaker, and then we'll see if you have any questions. Thank you very much.